Hey everyone, today I want to talk about this review article here. This is on fibromyalgia and some nutritional supplements. And this is from the Journal of Clinical and Experimental Rheumatology from 2015. I'm going to talk about 7 key things that they discussed in this article. First, let me start by saying that fibromyalgia is one of those really hard diagnoses to make and even harder to treat, I would say, in the office setting. We know there are several medicines for that, such as Cymbalta, but overall, there aren't any really great treatment modalities, and I think it's a multifactorial approach. Having said that, I think diet does play a role in this, so let me just talk to you about the 7 different categories of nutrients that they talked about in this study and what they concluded or tried to conclude from each of those. Nobody knows really why people get fibromyalgia. It has an unknown etiology, but it is characterized by chronic widespread pain and specific and non-specific symptoms such as fatigue, sleep disorders, depression, anxiety, and cognitive impairment. It is the second most common cause of visits to the rheumatologist, actually. They do see increased oxidative stress, so that's why antioxidants are important to fibromyalgia patients, and that they have a central nervous system that might be overly sensitized and have increased pain perceptions. So the first one they talked about is iron supplementation. And some studies showed that iron was reduced in patients with fibromyalgia, whereas other studies showed that there was no difference. So the conclusion on that was that they could not recommend iron supplementation for fibromyalgia. We do know that iron is a cofactor and helps in the production of certain neurotransmitters like serotonin and dopamine. So it's pretty relevant from that perspective as far as looking at that for treating fibromyalgia. But as of now, there is no data to support that iron therapy will help. They also go on to say regarding trace elements, number 2, that certain ones like selenium may play a role in fibromyalgia, but that the reports were contradictory in nature. So some studies showed that there was benefit and other studies showed that there was no benefit of certain trace elements. Selenium, zinc, and magnesium are essential for helping produce ATP and something called redox reactions in the body. And in some studies, actually regarding magnesium, they did see that there was some correlation with fibromyalgia and low magnesium levels, or also increased tenderness at muscle tender points, but other studies did not have the same findings. So again, those were mixed findings as well. They did see in fibromyalgia patients that they had lower levels of certain branched amino acids such as valine, isoleucine, leucine, and phenylalanine than control subjects. And that was significant because branched chain amino acids do supply the building blocks for energy in the body and regulate protein synthesis in the muscles as well. So the thought was maybe that the patients were not able to absorb those, or they were just not getting them in their diet. Next, we have micronutrient supplementation. They did a couple of studies looking at an organism called Pyrenoidosa, which is a green algae that contains high concentrations of chlorophyll, beta-carotene, vitamins, and minerals, so it's very high in nutritional value. And they showed increase in quality of life in patients after taking that had fibromyalgia. Cell Food was another nutritional supplement that had 78 different trace elements and minerals and 34 enzymes and 17 amino acids. And it was shown that it was a helpful antioxidant treatment, not only for fibromyalgia patients, but also patients with any neurodegenerative type diseases. They also showed benefit with coenzyme Q10 and ginkgo biloba after 84 days in one trial. And you definitely heard me talk about coenzyme Q10 before, its role as a strong antioxidant in the body. You can check out my Mediterranean diet recipes for that. And interestingly, they also talked about creatine supplementation as well. That was also beneficial in improving lower and upper body muscle function with minor changes in other fibromyalgia features. These findings introduced creatinine supplementation as a useful dietary intervention to improve muscle function in fibromyalgia patients. So that sounds promising. And also they talked about melatonin, which also seems to be promising in the management of pain in fibromyalgia patients. So that's another one that we're going to keep our eyes on. And then, of course, there's the vitamin D phenomenon. Now the question is, does vitamin D help fibromyalgia patients? Again, the data was inconclusive on that as well, but it is worth checking the vitamin D level in fibromyalgia patients. And then they also talked about in a certain review where magnesium, L-carnitine, and S-adenosylmethionine were considered supplements with the most promising potential for treating fibromyalgia patients. Then they talked about glutamate, the most excitatory neurotransmitter in the central nervous system, and at high concentrations can actually overexcite and cause neuron death. So there has been a lot of information about that on the scene lately. In one study, they showed that the discontinuation of MSG and aspartame did not affect symptoms of fibromyalgia. However, that's still not something that we can draw conclusions from. They also say that there is a link with IBS. Between 25 to 80% of patients with fibromyalgia also have IBS symptoms. That's a wide range. And that there is evidence that a celiac disease or a non-celiac gluten sensitivity is present in these patients as well. There is some evidence that a certain subgroup of patients with fibromyalgia might benefit from a gluten-free diet. As far as eating disorders go and nutritional status, the last two items on my list, there is research out there that shows that depression was more frequent in obese subjects that had fibromyalgia. There is a link with obesity and fibromyalgia, and that obesity does worsen the quality of life of patients and triggers metabolic changes in the body. It is not possible to say whether obesity is the cause or the consequence, though, of fibromyalgia. But the thought is that increased BMI, you can also see increase in the level of pro-inflammatory cytokines in the fibromyalgia patient. And so cytokines cause inflammation, and then inflammation just worsens the symptoms of fibromyalgia. So again, fibromyalgia is diagnosed when you have at least 11 of 18 tender points clinically in the office setting. They do conclude that the most appropriate approach for treatment of fibromyalgia is multidisciplinary, and among alternative therapies, nutrition has become increasingly important. They recommend that treatment programs should consist of weight loss strategies, nutritional education, specific dietary interventions as needed, and the use of some targeted nutritional supplementation as needed as well.